Are you having a baby soon or know someone that is? This is point number 2 of all of the things that your midwife should be telling you but probably doesn't have time to. So point number 2 is talking about birth plans. Now, I've met lots of women that don't really have a birth plan whatsoever, and it's actually quite good to go into labour not having a really particular idea of how you want things to go, because number one, if it's your first baby, chances are it's going to be an experience quite unlike anything else that you've ever experienced before in your life. And I know plans can change. They can change because of analgesia options changing, but they can also change because of your baby and your baby perhaps needing delivery in another mode as opposed to a vaginal delivery, and that would be because your baby was in distress most commonly. So things can change, and actually what we know is when you're in your normal labour, there's a hormone that's really important called oxytocin, and that is what brings on your contractions. Now, if you become stressed, which sometimes people do if their birth plan doesn't quite go to plan, you release cortisol, which is the stress hormone, and that actually stops oxytocin from having its effect on the uterus, so it can actually in turn slow down labour. So it's always good to have an idea of what you want. It is, and it's good to have done a little bit of research, maybe go onto some pain relief websites and just take a little look at your options that are out there for you. But I wouldn't say a stringent birth plan is necessarily going to be your best friend, because people just get stressed when it doesn't happen, and that's a real shame, because I think women, we especially have this thing where we're like, oh, it didn't happen, it's because of me, and it's like, no, it's because of biology. There's so many things that happen in labour and it's not your fault. So have a little plan, but don't have it too stringent. That's tip number 2.